Hello, my name is Nabila Azib. I'm plastic surgeon in Morocco and I'm also the head of the aesthetic medicine department at ICAMS. And I'm very happy to announce you our new course called M23A, which is a 3-day course.
First day, we had lectures with Professor Han Jin Kim, the great anatomist from Korea, and it's about the ultrasonic images and how to understand and identify the facial layers and the vascular structures. Then we have a great presentation with Dr. Nabila about all the layers of the face and all the areas of the face, indication, complication, and how to manage it. Then I have a lecture about threads and combination treatment with fillers and what can happen through the process of thread lifting and complication and how to manage them. Then in the afternoon, we moved to the wet lab and we had a hands-on course about the ultrasonic technology, identifying the layers and the vascular structure.
On day 2, the delegate will perform the dissection to see the layers of their injection and also to see all the muscle that we inject with botulinum toxin during our injections. In the afternoon, the delegates will try to reproduce fillers complications and also will manage to treat the complications, mainly the vascular complications that we can have with the fillers injections. So performing retrobulbar injections and dealing with the vascular compromise on cadaver is really the best way to be able to perform it in a real patient in case of vascular compromise in their practice. The objective of day 3 is to look at our patient with a more artistic approach, with more proportions and harmony, and where to place the product to achieve the same amazing result that a makeup artist can do.
It's really important for us to understand how you have to improve the beauty, not you have to improve only the volume or block the muscle. In this way you can use these skills that you learn in our course to have a really safe approach to the beautification of your patients.
They are giving us the keys to manage any complication. Can happen, you know, it's not our intention. Always we are trying to do the things in the best way, but sometimes these things happen, so we have to be ready, we have to be prepared, and this is what ICAMS is doing for us, giving us all the weapons, all the keys to know how to react in these situations.
It was just amazing, and then we had to do the hands-on, and I'm so glad that I joined. It was amazing.
Other course I can feel is like not intense like this. So be prepared. If you want to get into this course, it's not that easy. It's very intense because every single second is the very much benefit. You will get anything from this course, I'm sure.
We've had a great organization and really the best mentors ever. I think it's really difficult nowadays for young people to find mentors who are willing to let us know all their tricks and tips which can help us improve in our patient care, and that's exactly what we found out here at ICAMS, and I'm really grateful and happy for the opportunity, and I'll definitely recommend it to all of my colleagues to attend.
We had a makeup artist attending the course, and he was actually showing us how to do professional makeup artistry, and we tried to recreate the same with the threads and the fillers, the same effect. And this was highly unique. I've never seen it before in any course, and as I said, I can highly recommend it.
So you're kindly welcome to join us for this new way to approach our patients safely, effectively, and with a more artistic approach.